Okay. So let's continue from where we ended. Now, we are saying that pH, we are using the Henderson-Hasselbalch equation, that pH is equal to pKa plus log of salt over acid. And we are saying that for a buffer to work effectively, okay, the pKa of that buffer must be equal to the pH at which that buffer wants to maintain. Okay, the fact is every buffer wants to maintain a certain pH. That's what buffers do. They maintain a certain pH. Okay, so for a good buffer, the pKa of that buffer must be equivalent to the pH that buffer wants to maintain. Okay, so pH should be equal to pKa for a good buffer. Okay, good. Now we are saying that it's not always that you are going to get the pK of the buffer being equal to the pH, the pK of the buffer being equal to the pH. So then what we are going to do is that we are going to allow for a certain range. Okay, and the range that we are going to allow for should be that the pKa should be equal to the pH plus or minus 1.7. Okay, so if you fall within that range, then that buffer can work effectively at that pH. Okay, so that's all we are trying to say. That's for a best buffer, the pH should be equal to the pKa. But if we can't get this, okay, then we are going to allow for certain range. Okay, we are going to allow a certain range, and the range is that for us to use a certain buffer to maintain a particular pH, the pKa of that buffer should be equal to, okay, the pH plus or minus 1.7. So let's look at this. Let's look at the bicarbonate. Okay, the bicarbonate, okay, system has a pKa of 6.1, and we want to use it as a buffer for the human system, and the human system has a pH of 7. So the question is, can bicarbonate act as a buffer in a human being? And the answer is yes, because the pKa is 6.1. Okay, and from 6.1 to 7.4, what we have added is 1.3. Okay, and 1.3 falls within 1.7. Okay, because the range is that it should not exceed, what you are adding or subtracting should not exceed 1.7. Good. Let's look at the second buffer system. That's the phosphate system. If you look at the phosphate system, the pK is 6.8. Okay, it's 6.8. So that means that this can also act perfectly as a buffer of the human system. Okay, proteins also have, some of the proteins like albumin has pKa of 6.5. So it can maintain the body's pH at 7.4, because we are saying that the limit is 7.4 plus or minus 1.7. So if your pH falls within that range, then you can be used as a buffer. Okay, so we've seen that the first buffer is bicarbonate. Okay, now bicarbonate is the most abundant buffer system in the extracellular compartment. So for the extracellular compartment, we use the buffer H2CO3 bicarbonate. Okay, the other buffers like proteins, okay, proteins too can act as buffer system of the extracellular compartment. Okay, but some of the proteins are inside the cell, and then Hemoglobin 2 is a very important buffer system. Okay, so hemoglobin 2 can act as a buffer system, as well as the skeletal system themselves can also act as buffer system. So we've seen 6 major buffer systems. Okay, we've seen the bicarbonates, we've seen the phosphates, we've seen proteins. Okay, we've seen hemoglobin, we've seen cells, and we've seen the skeletal system. So these are the buffer systems of the body. Okay, good. Now let's look at certain principles. Now we saw that, okay, pH is equal to pKa plus of log of uh, salt over acid. Okay, but if we write it in this form, we will get H plus is equal to Ka multiplying the concentration of bicarbonate over the concentration of the acid over the concentration of the conjugate base. Okay, good. But when I convert it to pH, when I convert it to pH, okay, then pH is negative log. Okay, so if I'm writing it in pH form, the 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 salt becomes the numerator, the denominator. But if I'm writing it in concentration form, okay, the acid becomes the numerator. Okay, I'm sure you are okay with this. This is just mathematics. Okay, so the concentration of the acid is equal to the Ka times the the carbon dioxide over the bicarbonate. Now this is important. This equation is important because now the carbon dioxide level is controlled by the respiratory system, and the bicarbonate level is controlled by the renal system. Okay, so all that we are trying to show here is that effective pH is, or to keep the pH constant, okay, it involves both the respiratory system as well as the renal system. Okay, so that's one thing that I want us to keep. That's the respiratory system, or the lungs, and then the kidneys are important in maintaining the acid-base balance. Okay, good. Now let me, in fact, all these things are is good. Now there's a condition we call respiratory failure. Okay, let me talk about respiratory failure. Now, when you talk about respiratory failure, okay, we know the function of the respiratory system is to for ventilation, okay, ventilation and perfusion, okay, and to oxygenate the red blood cells, okay, give oxygen to the red blood cells to transport to the tissues. If you have low levels of arterial partial pressure of oxygen, we call it hypoxia. Okay, and hypoxia is, and you have to remember these values. When the partial pressure of oxygen is less than 8, okay, kilopascal. So when someone's partial pressure of oxygen is less than 8 kilopascal, we say that the person is in respiratory failure. Okay, now with the respiratory failure, there are 2 types. There is the first type, which is called type 1 respiratory failure, in which the person's oxygen levels are low, okay, but the carbon dioxide levels are normal. So we call this one type 1 respiratory failure. And we have type 2 respiratory failure, where the person's oxygen levels are low and the person's carbon dioxide levels are high. So if you have a state where only the oxygen levels are reduced with the carbon dioxide pressure being the same, then we say we have type 1 respiratory failure. But when your oxygen levels are reduced and your carbon dioxide levels are increased, then we say you have type 2 respiratory failure. Okay, now you should know what will cause type 1 respiratory failure and what will cause type 2 respiratory failure. The type 2 respiratory failure means that you are accumulating a lot of carbon dioxide in your system. The carbon dioxide cannot come out easily. So that's why the partial pressure of carbon dioxide increases. Okay, so now when you take the type 1 respiratory failure, we say it's hypoxia without carbon dioxide retention. That is low partial pressure of oxygen and normal partial pressure of carbon dioxide. This is what is called the type 1 respiratory failure. Now, what can lead to this? Okay, there are two major causes of this. Okay, the first one is impaired diffusion. So this is a case where the person is fine. Okay, the only problem with the person is that the oxygen that the person is breathing in cannot diffuse, okay, across the alveolar membrane to the capillaries to oxygenate the red blood cell. So and the problem is that something has come to increase the resistance. Okay, so the only issue this person has is that the oxygen that the person is breathing in cannot cannot oxygenate the red blood cells. That's the only problem. And then what can cause this is one of the cause of this is pulmonary edema. When you have a lot of water in your alveoli, the water increases the distance of separation. Okay, so though you are breathing in oxygen, the oxygen will find it difficult to diffuse into the bloodstream. So that's why pulmonary edema is a cause of type 1 respiratory failure. Okay, and then the second one is pulmonary fibrosis, where you have a lot of fibrous tissues in the alveoli. Okay, so the fibrous tissues make it difficult for the oxygen to diffuse into the capillaries. Good. The second cause of type 1 diabetes, type 1 respiratory failure is ventilation perfusion imbalance, okay, or VQ mismatch. Okay, so now when you talk about ventilation, we are talking about the effective ventilation. That is the amount of oxygen that you are bringing into the alveoli, okay. And then when you talk about perfusion is the amount of blood that is moving into the lungs. So the amount of oxygen that you are bringing in, okay, into the lungs must match the amount of blood that is moving into the lungs. So the perfusion over here is talking about the cardiac output, okay. So remember that ventilation is 5 liters per minute, okay. Perfusion, which is the cardiac output, is also 5 liters per minute. So they match so that every blood that is coming to the lung is oxygenated. But if you have any condition that disturbs the VQ balance, okay, it can cause type 1 respiratory failure. Okay, good. So some of the cause of ventilation perfusion balances is when you have a condition like lobar pneumonia. Okay, so this is due to the fact that some of the blood perfusing the lungs does not come in contact with functional alveoli. Okay, so yes, so we have already explained this. I'm not going to talk about all these things. Good. We also have cyanotic heart diseases. Okay, so if you remember from the cyanotic heart diseases, the blood bypasses the lungs. Okay, so in this case, you have low levels of oxygen. Okay, you have low levels of oxygen, but your carbon dioxide levels are normal. So this also leads to um, type 1 respiratory failure. Then when you go to the type 2 respiratory failure, okay, this is, as I have explained, it's a situation where you have low partial pressure of oxygen as well as high partial pressure of carbon dioxide. So you have hypoxia with raised partial pressure of carbon dioxide. Okay. Now, the only reason why the carbon dioxide levels, is raised is because the person cannot breathe the carbon dioxide out. If the carbon dioxide levels are raised, okay, you notice that the person will breathe faster, what is called hyperventilation, so that the person will bring the carbon dioxide out. But if I have a situation where I cannot perform this function, then the carbon dioxide levels will raise. So what can cause type 2 respiratory failure? Okay, now we have what is called the bronchopneumonia. Remember I said lobar pneumonia will cause type 1. Okay, but bronchopneumonia will cause type 2 respiratory failure. And if you have cancer, bronchial carcinoma, okay, it's going to happen. And if you have any of the COPDs, okay, the COPDs, asthma, emphysema bronchitis, okay, they are the COPD conditions. Okay, and if you also have asthma, they can all lead to type 2 respiratory failure. Okay, and this is because, as you know, they are obstructive conditions. So the oxygen comes in, but the carbon dioxide finds it difficult leaving. So the carbon dioxide will accumulate in the person's system. Okay, so you are having hypoxia with raised partial pressure of carbon dioxide. This is what is called type 2 respiratory failure. Okay, we are almost ending. Any questions up to this side?
Senior Bright,
Yes, please.
can you please go over the ventilation perfusion imbalance?
Okay, so the whole idea when you say ventilation perfusion, okay, balance, okay, when you talk about the balance, we are saying that the amount of blood that is going into the lungs, okay, per minute should be equal to the amount of oxygen which is coming into the lungs per minute, so that it's balanced. So that if, for example, I'm sending 5 liters of blood into the lungs in 1 minute, I must also send 5 liters of oxygen to the lungs in 1 minute, so that every blood that comes to the lungs is oxygenated. Okay, imagine I am bringing 5 liters of blood to the lungs, okay, in a minute, and then I'm only sending 1 liter of oxygen to the lungs in 1 minute. Then you notice that only 1 liter of the blood will be oxygenated. The remaining 4 liters will not be oxygenated. Then there is an imbalance over there. So that's the whole concept of ventilation perfusion balance. Okay, good. Now, as I said, the lungs and the kidneys perform important role in kidney acid balance. Okay, let me start with the lungs, because the lungs is very easy. Okay, let me start with the lungs. Now, if for example, you have a condition which later on I'll explain, okay, like an acidosis. If you have a condition like metabolic acidosis, which I'll explain later on, okay, what will happen is that your lungs have to breathe out or you breathe out carbon dioxide. Okay, so when the carbon dioxide leaves the system, Okay, it's a way of, because carbon dioxide is also acidic, it's a way of reducing the H plus ions. Okay, I'll show you equations, but there are two conditions that I'm going to talk about. We are going to look at the respiratory types and then the metabolic type. So we have respiratory acidosis, respiratory alkalosis, metabolic acidosis, and metabolic um, acidosis and metabolic alkalosis. Okay, so four of them: acidosis, alkalosis. Then you pair them with either respiratory or metabolic. Now the principle is this: if I have the metabolic conditions, then the first thing that will have to work is the respiratory system. So the respiratory system will set in first and work. Then later on, the kidneys will come in and support. That's the principle. So if I have, let's say, acidosis, okay, let's say I have metabolic acidosis, what's going to happen is that my respiratory system is the first system that comes in. So what my respiratory system is going to do is that I'm now going to breathe out very, very fast so that I push carbon dioxide away. Remember, carbon dioxide is also an acid, okay? So when I push it away, in a way, I reduce the pH, okay? In a way, I reduce the H plus ions. I'll show you equations. But if, for example, I have a respiratory acidosis or respiratory alkalosis, this case, the respiratory system is at fault. So you don't expect the respiratory system to compensate because the disease condition is with the respiratory system. Okay, so in this case, you are only going to depend on the kidneys. Let me take that again. If I have a metabolic acidosis or metabolic alkalosis, that one, the pathology is from somewhere else. So for that, your lungs are fine. So your lungs is the first organ to set in and then correct the acidosis. Okay, if it is not able to correct it, then the kidneys will come in and also correct it. But the fact is that if now the primary pathology is with my lungs, okay, either respiratory acidosis or respiratory alkalosis. When we say respiratory acidosis or respiratory alkalosis, we are saying the problem is with the lungs. Okay, so with this case, if you ask what is going to compensate, you can't say the lungs are going to compensate because the problem is with the lungs. So for the respiratory, either respiratory acidosis or respiratory alkalosis, you are going to only depend on your kidneys. Whilst for the metabolic types, you can use both your respiratory system, which comes in first, as well as your renal system, which comes in later on. Now, let's see, how does the kidneys work? For the lungs, I've already told you how the lungs work, by breathing out carbon dioxide. Okay, good. But let's see how the kidneys work. Now, what the kidney, for example, let's take someone with high H plus levels or someone with acidosis. What is the kidney is going to do? What the kidney is going to do is that the kidney is going to excrete. So the kidney is going to do two major things. One, excrete the H plus ions. And two, reabsorb or produce bicarbonate ion to go into the system to neutralize the H plus ions. Okay, so this is a situation where someone has a lot of H plus ions in a person's system. You don't want that to happen. You don't want that to happen. Okay, so what the kidney is going to do is that the kidney is going to excrete the hydrogen. Okay, so that you urinate it out, and in so doing, as it's doing that, it's also producing bicarbonate ion, so that the bicarbonate ion will go into your system and neutralize the excess H plus ion in your system. So these are the two important ways in which the how do you call it, the kidneys regulates the acid-base balance. Okay. Now, let's go into details. Let's go into details. Now, what's going to happen? Let me just use this diagram to explain. So let's consider this diagram carefully. This is the lumen. Let's say this is the proximal convoluted tubule. Okay. Here, sorry, this is the lumen. Okay, the lumen, and this is the cell of the proximal convoluted tubule. So the tubular cells. This is the lumen, and here is the blood. So your urine is filtering a lot of stuff, including the H plus ions, and also including the the bicarbonate ion. Okay. So now the first step is that as the bicarbonate ions are coming, okay, through the lumen, what's going to happen is that we can we can convert the bicarbonate ion to H2CO3, okay, by adding H plus to it. Okay, then we get H2CO3. Then the H2CO3 can break down into H2 and carbon dioxide. Okay, then the carbon dioxide will move into the tubular cells, recombine again to form H2CO3. Then the H2CO3 will break down to get the bicarbonate. Then now the bicarbonate will move into the bloodstream. So the whole process over here is how to reclaim bicarbonates, because we don't want, this is not a situation where we want the person to be urinating a lot of bicarbonate. So every bicarbonate coming here, okay, through the lumen must be reabsorbed. Okay, and then remember that the bicarbonate is an ion, it cannot pass through the cell membrane. So you convert the bicarbonate to carbon dioxide, which can diffuse across the cell membrane. When it enters the cell, we recombine it with water, get our H2CO3 back, then we break it down to bicarbonates. Then the bicarbonates will move into the blood. In this case, we have reclaimed the bicarbonates. Okay, this one way. Okay, there's also another way where I mean it's almost the same thing as the first one. Okay, let me use this one to explain. Okay, let me use this to explain. So one thing that can happen is that, you see, as the acid is coming, okay, as the acid is coming, the H plus acid, okay, the H plus is going to react to the H2CO3 and form the H2CO3, okay, and it will break down to carbon dioxide and water. Okay, so look at this very well. Now we can use the bicarbonate ions to absorb H plus. Okay, and we can also use the phosphate molecules to also absorb H plus. Okay, so this is the phosphate molecule. Okay, now remember, all we are doing is that we want to excrete H plus. There is a lot of H plus in the system. We want to excrete the H plus ions. Okay, and not only, as I said, not only do we want to excrete the H plus ion, but we also want to produce bicarbonates. So those are the two principles underlying all we are doing. Okay. If we didn't want to produce bicarbonates, then the H plus, which is filtered from the blood, can just move down into the urine. But this is a case where we want to make good use of the H plus. Okay. So what's going to happen is that we are going to combine the H plus to this phosphate group. Okay, we are going to combine the H plus to this phosphate. So what's going to happen is that for this case, okay, The carbon dioxide from the blood will move and combine with water. Then the water will be converted to, the water will add to carbon dioxide. You get H2CO3. Then the H2CO3 will give us the, how do you call it? The H2CO3 will break down to H plus and then HCO3 minus. Then the bicarbonate will be absorbed into the blood. So you can see that here we are converting carbon dioxide to bicarbonate. Okay. The difference is that here all we did was to reabsorb the filtered bicarbonates. So here is just reclamation. We are just reclaiming the bicarbonates, okay? But when we come here, okay, when we come either to this side or this one, okay, we are not reclaiming any bicarbonates, but we are rather producing new bicarbonates from carbon dioxide. So we call this one regeneration of bicarbonates, okay? This is regeneration of bicarbonates, not reclamation. Reclamation, we reclaim what has been filtered. Regeneration, we are producing new carbon dioxide. We can only produce new carbon dioxide when we use either the phosphates or ammonia, NH3. What they do is that, let me go over this again. The carbon dioxide will come here. It will enter the cell. It will combine with water. Then we form H2CO3. The enzyme is carbonic anhydrase. The H2CO3 will break down to H plus and HCO3 minus, okay? Then the HCO3, which is the bicarbonate, to be absorbed into the blood to go and neutralize the H plus ions. Then this H plus over here, which is produced, okay, will move over here and combine with the phosphate group, and then it will come down as urine. Okay, so that's how the kidneys manage to secrete H plus ions and also produce bicarbonate. Okay, so the same thing occurs over here, just that here we are using ammonia to accept the H plus ions. Okay, and in this case we are also producing new HCO3 minus, regeneration. Okay, please, any questions before we move on? This is the last part and the most important part. Please, any questions so far? If you want me to repeat anything, you can let me know. I'll do it.
Bryce, please, can you repeat the phosphate thing you're talking about?
Okay. So what I'm saying is that okay, let me show you this. What I'm saying is that in removing H plus ions, okay, they are let me just say this. In removing the H plus ion, there are two ways we can remove H plus ion from the kidneys, okay. The first one is the filtered H plus. So those ones we call them the filtered H plus. So that one is filtered from the Bowman's capsule, okay. So the filtration. And then we also have secreted H plus. So for the secreted H plus, the renal cells are the ones secreting the H plus, okay. Now, the ones which secrete the H plus, okay, also regenerate bicarbonates. So this is what is happening. Carbon dioxide from the blood, okay, will enter into the tubular cells. Then it will mix with water. It will react with water, and then you get H2CO3. The enzyme over here is carbonic anhydrase. When we get this H2CO3, it will break down to H plus and HCO3 minus. Okay. Now this H plus over here will be secreted. This is the process called secretion. So secretion, this is renal tubular cell secretion of H plus ion. So it has secreted H plus ion. This H plus ion is going to combine with the phosphate group and come down as urine. Okay, so we are just using this phosphate group to accept the H plus ion, which is acid. So if this process continues, you realize that your system will be losing a lot of H plus ions to compensate. Okay, now what happens to this bicarbonate? This bicarbonate will also move into the blood stream and will also go and neutralize the excess H plus ions. So this is how the renal cells or the nephrons compensate, okay, or deal with acid-base imbalances, okay. So I'm saying that you can either use a phosphate group to accept this secreted H plus. I'm saying secreted H plus. Okay, either you use this phosphate or you can also use ammonia. So ammonia also does the same work. You realize that it's the same thing, just that in this case we use ammonia. Okay, and someone will ask, where is the ammonia coming from? The ammonium is coming from the amino acid glutamine. Okay, then we are going to use the ammonia to accept the H plus. Okay, so we will come back again.
Thank you.
Welcome. We will come back again and finish the last part. Okay, good.